And then there is something called the income-related monthly adjustment amount. And this is something that I think catches many people off guard. There is a surcharge that you would have to pay to Medicare for your Part B and Part D coverage if indeed you make too much money. So you see on my chart there that if you made between, well, let's just pick married, modified adjusted gross income, that's MAGI joint. So let's just say you made 182,000 to 228,000. Not only would you pay the $170.10, but then you would each pay an additional $68 for the IRMA, the income-related monthly adjustment amount. And if your Part D plan was $40 in premium for drugs, you'd pay another $12.40. So, you know, you'd be paying $290.50 a person in that scenario. So it adds on to the surcharge depending on, you know, how much money you make. And the deductibles. So Part A, it's $1,556. These all go up each year, by the way. So Part B, so that's the prescription, that's the medical coverage by doctors. So the $233, I think last year was like $208, so that's gone up a little bit. And then $480 for prescription drugs. So normally if you're on expensive medications and you're filling a prescription drug refill in January, normally you're hitting that deductible, and then, you know, the premium, the costs begin getting paid by the plan. But those are all the deductibles that you'd pay. Coinsurance. So for Part A, hospital, you know, I mentioned that the first 60 days were free, but days 61 to 90 do cost a coinsurance amount that you would pay. Part B, so that assigned claims is 20% of Medicare approved rate. So that's exactly why you have a supplemental plan, is to pay that 20% so you don't have to. That's just very critical to have a supplemental plan. Part D coinsurance, you pay a $480 deductible, and then 25% of the drug costs after deductible has been made until you get to a number of $7,050 out of pocket. Now that's what's known as, and many people have called it this, it's called the donut hole. So basically you pay initially and then you pay a lot more through. So if you look at a donut, you pay initially and then you pay a lot more in the hole, and then the plan comes back at the end there. So drugs are going to vary widely. So again, the Part D plans are a private insurance company. Anytime you hear it's private, you can shop. What I recommend to folks is that every year, once you're on your prescription drug plan, every year there is an open enrollment period from October 15th to December 7th. And you should put in the Medicare.gov software what the medications you're on, even if they haven't changed. And the reason I say that is because even though the medications that you're taking haven't changed, the formulary that the private insurance company uses to pay for that drug, they may have changed the formulary. And indeed, it might be more expensive for you to be on that plan. So you just want to make sure that you're checking to make sure the plan that you're on is still the most cost effective for the situation you're in. That's just the coaching I would give you there. So, okay. What Medicare covers? Well, again, the hospitalization, well, 100% of the first 60 days, medical services, 80% of the Medicare approved rate, and then some preventive services are covered. What Medicare doesn't cover, well, long-term care. That's a big one. Long-term care is a big one. Care delivered outside the United States. I've been asked that question several times. Does Medicare cover me, you know, if we elect to move to Costa Rica? No, you'd have to get a health plan within Costa Rica that would cover you. So dental care, vision care, hearing aids, cosmetic surgery, acupuncture, etc. So those are the things that Medicare does not cover, which I think it's important to understand that. What private insurance may cover. So now this is why it's so important to have this supplemental coverage, because it could cover the Part A deductible. And remember, I said that was $1,400 some odd per spell of illness. Hospital costs after 60 days. So if you have a really big issue with your heart, for example, you could actually be in the hospital for longer than 60 days, and your supplemental plan would help pay for it. The 20% of doctor bills that Medicare doesn't pay. When it comes to prescription drugs, your supplemental plan could pay the deductible. Really depends on the plan there, but it could. So really is important to have that plan in place. So Medigap policies. So these are these, I use Medigap and supplemental policies interchangeably. So I don't want anyone to get confused. Medigap and supplemental policies are interchangeable. And again, that's the private policy you'd obtain to cover the 20% that Medicare Part B doesn't pay. So these are private insurance companies for private insurance for individuals. They are sold by private companies. So right away, please shop for your coverage. The supplement, original Medicare, Parts A and B, they follow state and federal laws and guidelines that help protect you. Medigap insurance, can only sell standardized Medigap policies identified in most states by letters. I'll show you on the next page kind of what that looks like. Massachusetts, Minnesota, and Wisconsin standardize their plans a little differently. So I'm not speaking about those states. I'm based in New Jersey myself. It does not work with Medicare Advantage. Now, let me talk about that a little bit. It is illegal to sell you a Medigap policy if you've indeed decided to take Medicare Advantage. And the reason for that is because the 20% that Part B doesn't cover never comes up in a Medicare Advantage payment plan. If a doctor decides to have you as a Medicare Advantage client, that doctor receives a payment from the carrier every month, whether you show up or not. So when you do show up, they don't get any more. So it's almost like a little annuity that the doctor gets for agreeing to take you on as a Medicare client. So there is no Medigap or supplemental plan that comes into play in that regard. You pay a monthly premium for this, and costs vary by plan, company, and indeed the location you're in. I'll just give you an example. I have clients in Florida. I work out of New Jersey, but I have clients in 14 or 15 different states. The Medigap policy in Florida was double what they're paying up here. So location does matter as far as what your costs will be. Here's a little snapshot for you of the Medigap plans. E is not missing. I've had people say you skipped E. No, E is no longer provided, no longer offered. The most comprehensive plan on the chart is F. F was also discontinued. G is now the plan that most people will go with. Depending on your situation, location, they all cover the same thing, as you can see from the left. But, a plan A in New Jersey is going to have a different cost than a plan A in Delaware. So they cover the same things, just the costs are going to be different because the carriers are different. Okay, so Medicare Advantage plans, a little bit about them. So health plan options approved by Medicare. It's also known as Medicare Part C. So again, when you hear Medicare Advantage and Part C, it's the same thing. Okay, they're used interchangeably. That is the third group that's run by private companies. So again, you have your supplemental plan, private company, Part D, private company, Part C, private company. Medicare pays amount for each member's care. You may have to use a network of doctors and hospitals. Again, I mentioned that with my mom. She was very happy that her GP was in her plan, and we went with it. So others, if you have a very specific want that you want to have the person you've been working with for 15, 20, 25 years, and they're not in your Advantage plan, well, that may be good enough reason to sign up with original Medicare instead of going with a Medicare Advantage plan. The plan may include a prescription drug coverage, may include extra benefits like a vision and dental plan, and the benefits and costs vary. They vary between states and counties.